Hello, thank you for joining us for today's National Alzheimer's and Dementia Resource Center webinar series, sponsored by the Administration for Community Living and hosted by the American Society on Aging. Today's discussion is on developing successful volunteer opportunities in dementia programs. We will be getting started in just a moment. Before we do, a few housekeeping notes. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you will find information on how to obtain CE credit for this event. You have 60 days to complete your continuing education application, and it may take up to 30 days for us to issue and process your CE credit. If you are not logged into this webinar directly, that is if you're watching as part of a group and did not use your own confirmed individualized URL, you will not be eligible for CE credit because we will not be able to track your attendance. Any questions during today's presentation, you can send those to us at any time using the questions box, and we will save those in just minutes of today's program. And now I'd like to go ahead and turn it over to Sari Schumann of the National Alzheimer's and Dementia Resource Center.
Thank you so much, and thank you all for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Developing Successful Volunteer Opportunities in Dementia Programs. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin?
Good afternoon, everyone. Thank you so much for taking the time out of your busy schedules to join us today for this very important webinar on using volunteers in support of your dementia programs. I want to thank Melissa Black from the Durham Center on Senior Living and Daphne Johnston from the Respite for All Foundation for sharing their wisdom with us. And with that, I will give it back to you, Sari.
Thank you so much. As you heard, today's presenters are Daphne Johnston and Melissa Black. Daphne Johnston founded the Respite for All Foundation to help individuals living with dementia find purpose and hope through new relationships, basing this on a volunteer model. She has helped inspire 25 new programs, and in 2021, the Respite for All Foundation won the coveted 2021 Ann and Irving Brodsky Innovation Grant from the Alzheimer's Foundation of America. We also have with us today Melissa Black, who has served the aging community for many years throughout her career. She is no stranger to the Durham Center for Senior Life, as she has worked directly with the center's partners as an aging and disabilities professional. I'll now turn our presentation over to Daphne Johnston to begin. Daphne?
Thank you. My name is Daphne Johnston, and I am the director of the Respite for All Foundation here in Montgomery, Alabama. We began our program 10 years ago in 2012, and you're going to see so many people through these slides, but I want you to know this whole volunteer movement began with 2 participants living with Alzheimer's and dementia and just 14 volunteers. In the past 10 years, we have logged over 100,000 hours of volunteer time with just 2 full-time employees. It's just been amazing. And 5 years ago, we decided that we wanted to share this vision and this volunteer model with the country. And I had a caregiver give me $50,000 to start this foundation. So I just wanted to give you a brief background of how we began. As Sari said, we won the coveted innovation grant from the Alzheimer's Foundation this year. That's helped us put together video trainings that we can share across the country, so stay tuned for that. But today I want to talk to you about 2 main points. Number one is we're going to focus on how to identify 6 factors in building a volunteer model that's sustainable. I had 15 years in long-term care, and I know that sustainability is vital to all of our programs. So we're going to then discuss what's in our mindset when we train our volunteers, how do we train them in communication, and scheduling. You know, scheduling is so important when we're working with the volunteer programs. So that's what I hope to focus on today. I wanted to just give you a brief 30-second clip, really, of who the foundation is, so you'll have a better vantage point of who we're serving and who we are. Thank you.
Respite provides relief, purpose, meaning, and it provides hope. It's real hope for families living with Alzheimer's and dementia.
Respite for All is simply reclaiming joy.
The respite model is just a new type of charity. It's a charity of spirit.
Thank you. That was our 30-second clip, and if you want to see that in its entirety, you can look on our website, respiteforall.org. It goes into greater detail. As you can see, we started with 2, but now we have 25 participants coming today. Before COVID, we're down to about 20 a day and 15 to 20 volunteers a day in the local program. That's not to say our smaller programs that have begun across the country range anywhere from 10 participants a day to anywhere from 10 to 15 volunteers a day. So we have all different kinds of sizes. I really want us to focus on a view from the care partner right now because it feeds into the volunteer success. What we've identified in long-term care placement is said best in these 4 points: a care partner's illness, social isolation, feelings of burden, and the acute sensitivity to worsening symptoms of dementia. To me, all of these stem from that social isolation. This volunteer program, I'm telling you, it's not just for the person living with Alzheimer's. It's also to serve that care partner, but it's also to serve the baby boomer volunteer to become a champion, to help fight stigma of people living with this disease. And so that's where we named it the Respite for All Foundation, because we look at this through a holistic approach. We want to serve everyone. Our volunteer model tends to be about 1 volunteer to every 2 participants, and sometimes we have more volunteers than we have participants because we can't keep people away. But it's a packed house in all of our communities. These are the things that we focus on in our training. So oftentimes, I think in other programs I've seen, we get bogged down in amyloid plaques and neurons and the brain science, and yes, that's important. But when we're running a volunteer program, I want these guys to know that this program, our program, is about cultivating relationships, right? It's not about our deficiencies. It's about what have we still got to give. Respectful communication, honoring agency and choice. In our program, our volunteers are really trained to create space for the person with Alzheimer's and dementia to still give back to the group. It's not really a babysitting service, right? All of you know everybody wants to matter. And so in our volunteer training, we focus on how do our volunteers create a space for people to still matter, right? Everyone can contribute. So we go through a lot of exercises noting those differences. Celebrating the small moments, no-fail atmosphere, creating well-being. I'm sure many of your programs do the same. Our unique angle, I tell people all the time, we are not a medical model of care, but we're social. From 10 o'clock to 2 o'clock, we pack it with activities and art and music, small group conversations, exercise, the shared meals. I'm telling you, what means the most are the new relationships. And so when you've got a staff on hand, I did long-term care long enough to know a staff, you're never equipped with enough people to stop and have a 15 or 20-minute conversation. But with volunteers, you can. And how do we train them to be in communication with someone that might not be verbally adept? How do we do different things to bring people into conversations through different challenges? So we are a social model of care. We don't pass medicines through the day. We don't need a nurse. This is 4 hours of your neighbor pouring into you. One key component is you cannot tell the difference between the volunteers and the participants. You're going to see a lot of pictures through this short slide deck, but you can't tell who's who, and that's designed on purpose. I had a lady one day, if you've heard me speak before, this is our signature story. but it's so important as to who we are. She had dementia and she was still driving. Probably shouldn't have been, but she spent the day with us. I didn't really even know what to do with her, but she stayed with us all day. And if you could see me talk, I slapped the table right about now. So I go, wham. And at the end of the day, she looked around the room and she said, damn, this is just better than AA. Oh, my goodness. We all lost it. We were like, lady, what are you talking about? And you see, this is our name tag door. These are all the names of Respite. We've actually got 4 doors of names. And what she had noticed was we didn't care. She said, you don't care what our last name is, and you're all just meeting us where we are, right? We all come in on the same level because our belief is we're all dealing with something. And I think the volunteers really appreciate that level of equality. We want to find a way for them to matter. This is just a small picture of flood kits we made for a service project. This is dog food and cat food we pack quarterly to go for Meals on Wheels. You know, I encourage you in your programs, find a way for your people with dementia to still matter, to do these community service projects. And I know it takes volunteers to make that happen. This is one of my new favorite slides, the secret sauce of our volunteer success. People say, how in the world do you get that many volunteers? How do you get them to stay? And it could be viewed as my personality. I know I'm a firecracker at times, but I've got 26 other directors that use this system, and it works. We have a flexible schedule. You know, oftentimes I know that volunteer programs sometimes can make things too hard for people from the community to be part of your program. We invite people in to come visit for the day to see if it's their cup of tea. They can sign up for a training later on, but I tell them, you don't have to respond. You don't have to reply to our scheduling emails every week. You do not have to work every Tuesday. You don't have to work every month. The magic of our system is we have a pool of volunteers, and that way more people are attracted to us, and the right people are there on the right days. If I knew we were going to be short, I would have enough time to get on the phone to call to get back up. But when you have a system that's guilt-free and people don't have to find their own sub, I tell them in our volunteer training all the time, do not run from me in the grocery store. You know, I don't want you to live with guilt because you haven't been to work. On the other hand, when you get a scheduling email, do not respond with your colonoscopy stories. I don't care. I just need you to say, yes, I am working Tuesday the 16th. We schedule 2 weeks out, so we have plenty of time to gather people if we need to. That large pool of people, and when you get volunteers that are happy, we all know that they are the best advertisement and word of mouth. Most of our volunteers are all baby boomers. We have students during the summer, but most of them have been affected by dementia. And our message is, you know, if you've ever wanted to help an Alzheimer's family, this is the way you can do that locally. This is the way you can help your Uncle George. This is the way you can help your neighbor, Sally. Find a way to help locally. That's a great message. They become our best donors. They become part-time help. They encourage one another. When they know that Tom Watson and their golf group is volunteering, you know, the rest of the guys might come and do the same. When they know that Tricia C. is a teacher from a certain school and in retirement she volunteers, they follow one another. It's not necessarily the leader, but it's our job as the director to inspire these volunteers to want to invite their friends. I want to give you a prime example. When we started almost 10 years ago, I had 30 volunteers, and I said, I want you guys to go get one friend from outside of this local church, this host church. I want you to get one friend and bring him to the next volunteer training. That's your call. And do you know, every single one of those 30 people got one friend to the next training. We went from 30 volunteers to 60 overnight with no print ad, no commercials. Use the people you've got. And you've got to be able to create that inspiring environment for them to be in. This is just a brief example of communication that we would use in our volunteer training. We validate our speakers' perspective and feelings. We pay close attention to nonverbal communication, and we thoroughly believe in Montessori principles. So when I can share those kind of things with our volunteers, they really feel like they're learning something, and they feel like they can make a difference. Volunteer satisfaction. You know, when you invite people to come volunteer for a day and not make them have to wait until November the 16th for a training, invite them to just come see what's happening. They find out that it's not depressing, that it's uplifting, and there's laughter. I had one volunteer that said, I feel like I have marked effort. I feel like I have a real effort, not just dropping a casserole off at a door, but I have really made an effort to help the lady down the street from me. So, you know, what have you got to celebrate that? How are you pointing that out to your volunteers? The same volunteer, she gave this quote, there's an exhaustion at the end of the day, coupled with joy, that is sustainable from serving others in such a meaningful way. How do we celebrate those volunteers? Are we texting them through the day, thanking them for their efforts? What are we doing to celebrate them? Because I found in the past people focus so much on the person with dementia, or maybe even the caregiver, that sometimes we take for granted our volunteers. And to me, I think we've got to celebrate them all, and I think that's worked for us. This is just a slide of the first 16 communities we started. I'm sorry the pictures are small, but as they said earlier, we've now begun 27 across the country, in 5 different states, 3 different denominations. It works best, our system works best in churches or the faith community because it's sustainable. We have no overhead, minimal paid staff. You know, we normally have one director and a team of anywhere from 8 to 15 volunteers. And again, this is a social program. Insurance remains low for the church because of our background checks and training. And of course, we have community partners, and we also charge a $40 fee for the day, $10 an hour with a hot lunch, but no one's turned away. We have plenty of scholarship money. So now I wanted to take us from a different angle of what this volunteer program means to a care partner. This is from one of our programs in Birmingham, Alabama. If we could play that video.
Well, the first time he was a little apprehensive about coming, and now this is where he wants to be on Tuesdays and Thursdays. Well, I think he summed it up best for us, Susanna. Maybe 2 or 3 visits here, and when I picked him up and we were leaving to go home, he said, "These people get me." And see, I think that's so critical for him and for me, because you folks know what we need and what he needs. And he's not here as a serious dementia patient. He's here as a wonderful, warm human being, and he's treated that way. And that is such a blessing.
Wow, right? What a blessing that lady is. I've not even met her yet, but she nailed it. These volunteers get our participants. They wake up to get to respite, and I hope you all have programs like that where people reschedule their week around their day at respite. So we're thrilled to have that video, and I encourage you. That was a kid in the summertime that made that video on his phone. They added the wording to it, but you know, if you don't have clips and you don't have social media to celebrate your program, I encourage you to do that. Last but not least, we've entered into a partnership with Dr. Stephen Sabat I was invited to speak in Australia at an international spirituality and dementia conference. And they said, you need to find Dr. Sabat at Georgetown in D.C. And sure enough, everything he's written about, we are actually doing in our volunteer model. And so he's done a year-long research study on our care partners. And you can see the improvement before respite and after respite. That bottom line is after respite. Improvement in behavior problems, increased sense of purpose, a decreased sense of anxiety, an improvement in confidence and self-worth, an improved mood. I promise these volunteers are better than anything that's found in a pill bottle. How do we train them? How do we inspire them? And how do we keep them working, right? How do we find them? And I'll close with just a short story. I always have a slide that says Lewis and Clark at the end. I was recently reading a book on adaptive leadership, and they gave the example that Lewis and Clark set out across the country to find a waterway to connect the nation, right? They got halfway across the country, and they ran in to the Rocky Mountains, and they had to decide if they were going to turn back or if they were going to move forward and adapt. Because, you see, all they brought were canoes because they were looking for a waterway. They had to adapt, leave the canoes behind, and find a new way forward. And as I read that book on leadership, I recognized that we need a new way forward in dementia care. I'm 45 now, and in 30 years, I will be 75, and there'll be 15 million people with Alzheimer's and dementia. We've got to adapt and find a new way forward. We can't have 15 million people in a memory care unit. So I beg you, check out our volunteer model, and if you've got any questions, my book is on Amazon, Reclaiming Joy Together. It walks you through how to start a program, but it's got a lot of volunteer tips in there as well. I will turn it over to our next presenter. Thanks so much. Visit our website. Thanks.
All right, thanks so much, Daphne, for that wonderful presentation. So I'm Melissa Black, and I'm excited to share all of the good work that we're doing at the Durham Center for Senior Life and in partnership with our student volunteers. So just a quick word from our sponsor. I just want to make sure that you all are aware that the points of views and the opinions shared in this presentation are mine and do not necessarily represent official ACL policy. So the Durham Center for Senior Life was founded in 1949 as the Golden Age Society to provide neighborhood clubs for seniors. The agency received its first Older Americans Act in 1966 and officially changed its name in 1968 to the Council for Senior Citizens, and then again in 2010 to the Durham Center for Senior Life. Today, we're an independent 501c3 nonprofit organization. We are designated by the state of North Carolina as a center of excellence. And with 3 senior centers, DCSL is able to offer a wide array of programs and services for older adults. So the mission of DCSL is to enrich the lives of Durham seniors 55 and older by promoting healthy, active, and independent lifestyles. Our vision is that we will provide a variety of centers and services for adults 55 and older in Durham County that focus on the following building blocks. To include physical, emotional, and spiritual well-being, connection to essential community resources, authentic socialization and engagement, and then cultural enrichment and ongoing learning. DCSL services include congregate meals, exercise classes, socialization, health promotion, caregiver support services, respite care, information and assistance, options counseling, our brain health and dementia education, and our dementia care management services. In addition, DCSL operates the only adult day health center in Durham. So DCSL also works to influence the aging landscape in Durham. One example is our participation in the development of Durham's Master Aging Plan. The Durham MAP is a 5-year plan that provides comprehensive and coordinated delivery of community services and supports that foster lifelong community engagement and well-being to older adults in Durham. DCSL was integral into the development of this plan and is working with other stakeholders in implementing its strategies to make Durham a more livable community for all of its residents. So guiding the Durham Master Aging Plan were the 9 cross-cutting issues, and you can see them listed here. I do want to point out that number 7, intergenerational opportunities, it was listed as the steering committee recognized that programs, funding streams, and service delivery systems that are age-segregated have created silos. They recognize that it's these silos that prevent us from solving complex community issues that adversely impact people of all ages. The intention of the Durham MAP Steering Committee was elevating intergenerational opportunities in order to bolster a shared sense of civic responsibility and identity among Durham residents. So now I'd like to pivot to the intergenerational opportunities that exist at DCSL. So Durham is fortunate to have 2 esteemed universities, Duke University and North Carolina Central University. North Carolina Central University is one of 11 historically Black colleges and universities in North Carolina. Duke student volunteers help support our evidence-informed intervention time slips and our weekend respite care program, while Masters in Social Work candidates from North Carolina Central University volunteer their time and help support our dementia care management program. So here on the slide, you can see our primary recruitment strategies for both schools, which I will go into further detail in the next several slides. So Duke Hand is an undergraduate student organization that seeks to provide their members with the real-world experience of working with and caring for individuals with chronic neurological conditions with a special emphasis on dementia. The Duke Hand volunteers are truly looking for that one-to-one connection with individuals living with dementia. The leadership team for this student organization is well organized with a 7-person team that is responsible for marketing, programming. They develop their own continuing ed. They have community and student engagement. The leadership team also is responsible for recruiting their fellow students, determining their interest and capacity, and then helping to place them with an appropriate agency. Again, with DCSL, Duke Hand students are placed with the evidence-informed intervention time slips or our weekend respite care program. So last year and again this year, Dr. Sarah Wolber, who is an associate professor of the practice of dance and theater studies at Duke, has partnered with DCSL as a site location for her service learning course, Artists in Healthcare, Collaborations and Complexities. This service learning course introduces the rapidly expanding field of arts and health from the perspective of working artists. In this class, they also focus on how well art works in ameliorating health issues and how artists work inside of health collaborations. Through this partnership with Dr. Wolber and her students, DCSL was able to serve as a service learning site for 50 undergraduate students the first year and then 10 students this year. Now moving to North Carolina Central University and their work with us in our dementia care management program. So the Masters in Social Work program at NCCU is grounded in the concept of social and economic justice with a focus on African Americans and other at-risk populations in the context of an urban inner city environment. I think it's important to point out that many of our DCSL participants are alumni, and there is great pride amongst our participants in welcoming these students to DCSL. Our dementia care managers are a master's level and a bachelor's level social workers, and they serve as the field instructor and task instructor respectively for the Masters in Social Work field program. They coordinate with the Director of Field Instruction and faculty field liaisons to identify 2 Masters in Social Work candidates to volunteer within our dementia care management program. These students are then placed with us for the fall and spring semester, volunteering 336 hours each semester. So this slide shows the training requirements for our time slips and weekend respite care program volunteers. The online training includes 6 modules that takes approximately 2.5 hours to complete. Each module delves into the key concepts of the time slips method, including exploring creativity, ageism and person-centered care, key concepts and what's needed to facilitate a successful time slip session, the demonstration of the key components of the time slips intervention, and then how to practice creative engagement. The 6 online time slips modules are intended to improve attitudes towards dementia and are evaluated by administering the dementia attitude scale before and after the training. The weekend respite care program volunteers are required to attend DCSL's brain health and aging training, as well as review Dr. Al Power's Domains of Wellbeing modules. The Domains of Wellbeing presents a strengths-based approach that focuses on enhancing the 7 domains of well-being for individuals living with dementia in all environments. The 7 domains of well-being that are explored within these modules are identity, connectedness, security, autonomy, meaning, growth, and joy. The impact of these trainings are evaluated pre and post with the Dementia Knowledge Test and the administering of the Dementia Attitude Scale. So our North Carolina Central University Masters in Social Work students are required to complete the Alzheimer's Association training and certification. This training covers the basics of Alzheimer's and dementia, person-centered care, assessment and care planning, activities of daily living, and communication changes in dementia-related behavior. Additionally, our Masters in Social Work students are then required to review videos available on the Act on Alzheimer's website. These videos include an introduction to cognitive screening, administration and scoring, how to communicate those results, shared decision-making and assessing capacity consent, and then care coordination. This training is evaluated in a pre-post manner using the Dementia Knowledge Assessment tool and a self-efficacy instrument we designed to measure the confidence of our MSW students in screening, assessing, and providing dementia care coordination for our dementia clients. So of course, we want to make sure that our student volunteers are enjoying what they do and we value their volunteer experience with us. Our Duke undergraduate students shared they really enjoy how Time Slips is a creative group storytelling project for people living with dementia. In Time Slips, the focus is not on memory, but imagination, using improvisational storytelling. The undergraduate students became certified Time Slips facilitators and have co-led Time Slip sessions at our 3 engagement sites. Of course, COVID impacts all the things that we have done in the past. But in this instance, the undergraduate students were really vital in helping us remain connected to our seniors who were isolated due to COVID. So COVID-19 and social distancing delayed the start of our Time Slips intervention as we worked to adapt it to a virtual model. Thankfully, our students were able to quickly pivot and were able to engage with socially isolated persons living with dementia either through Zoom or on the phone using core components of this intervention. They were able to connect with these older adults by asking them beautiful questions, such as what is something you treasure in your home and why? Again, really focusing on not on memory, but imagination using that improvisational storytelling. Students reported back this interaction was just as meaningful to them as it was to the socially isolated person living with dementia. They too were socially isolated and felt disconnected from their peers as they navigated the pandemic. So here's a really lovely quote from one of our volunteers. Young students and adults want to engage with elders in a mindful way, but often do not know how. Elders experiencing memory loss seek meaningful connection, but sometimes find it challenging to explore commonalities with children and young adults, especially if asked about their past. In a time of significant physical distance due to COVID-19, the work of Time Slips and the Durham Center for Senior Life facilitated open-ended conversations, art-making sessions, and honest discussions about mental and emotional health for elders living with dementia despite their memory loss. Additionally, our weekend respite care volunteers were able to meaningfully connect with persons living with dementia through their one-on-one interaction with those individuals who are not used to being away from their home or away from their primary caregiver. So the volunteer experience our Masters in Social Work students have allowed them to really put their social work skills they have learned in the classroom into practice. So our dementia care management program, the goal of that is to really identify persons living alone with dementia in the community. We want to make sure that we're able to deliver our dementia care management services to those individuals who meet our eligibility criteria. And then of course, we want to evaluate the service that we're providing to make sure it's really helping them. So the Masters in Social Work students, they have assisted us with a comprehensive intake and assessment, which includes evaluating a client's activities of daily living, instrumental activities of daily living. They have gone through and done a home safety checklist with our dementia care managers. They've administered the PHQ-9, which is a depression screen. They have assessed our dementia clients for nutritional risk using the MINA-SNP. And of course, they have screened them for unmet needs using the Adapted Crisis to Thriving Scale. And then, of course, assessing their quality of life using the Quality of Life Alzheimer's Disease Scale. They then work with a dementia care manager to assist with the development of a care plan and connecting them with appropriate services and supports. These students finish the year with our dementia care program more confident in their social work skills than when they started. So I wanted to talk about the benefits to DCSL and having students volunteer with us. And this includes maintaining and strengthening our relationship with our academic partners. Utilization of the student volunteers allows staff to maximize their time at work. And of course, we're always thankful for the in-kind donation. It's an important source of nonprofit revenue that we're able to report. Of course, our students also volunteer our students also benefit from volunteering with us. And this includes the opportunity to apply what they've learned in the classroom. They're being exposed to the field of gerontology. They're able to bolster their resume. And of course, like everyone else who volunteers, it also improves their mental health and well-being, especially as evidenced through COVID. So of course, through all of this, we've had some challenges and we've learned some lessons. I think the first lesson that we learned is to learn how to say no. So that first year, we quickly learned that 50 students from a service learning class is too many. And so as a result, we have smartly reduced it to 10 this year. That's a much more manageable number. We've also learned that we need to set a minimum number of hours or time frame for volunteering. We did have a medical student who approached us for a 6-week rotation. And we did it only once as we realized it was too much work to onboard them and set up a rotation schedule through our various departments for a total of 18 hours of volunteer time. It was lovely that she wanted to come to us and volunteer, but it was just a lot of work on our end to set up a meaningful experience for her. Another lesson that we've learned is that we must have concrete onboarding procedures. So students are time limited and we want to maximize their volunteer time. We need to have systems in place to quickly onboard them and train them. And then students are really busy, much like all of us. And so we need to have like really clear and consistent email communication, guidelines and expectations. And so finally, we have learned that, in order to sustain this volunteer model, relationships and communication are really key. So the way that we are fostering our relationships is that we continue to work with the student hand leadership team. We're in constant communication with them. We attend their student meetings and share information on the volunteer opportunities available at the Durham Center for Senior Life. With the service learning course, we have worked closely with Dr. Sarah Wilbur, and we've co-created the service learning opportunities here at the Durham Center for Senior Life. We were also able to kind of provide that feedback that 50 students was too many and that 10 was a more appropriate number. And then finally, with the North Carolina Central University, we really work with the field instruction team to make sure that we're providing adequate student supervision, providing feedback on the students, and then of course, conducting a formal evaluation to the field office. And that is my presentation.
Great. Thank you so much, Melissa and Daphne, for wonderful presentations. Provided excellent information. We really appreciate it.
Good. Thank you.
You are welcome. So we are going to move to questions right now, and thank all of you again for participating. You can enter your questions in the Q&A chat pod, and while you're doing that, I'm going to move back here so you can see that we soon will have a new deliverable for you on the NADRC website that talks about the grantee engagement of volunteers in dementia activities. And this will go through various examples of the Alzheimer's dementia grantees from ACL. You can learn about how grantees engage volunteers in dementia activities, how they recruited, trained, and sustained their volunteer programs. You can read highlights from 6 grantee projects, and you can access a variety of resources and templates including sample descriptions for volunteer positions, marketing and messaging tools, and other information. So you will be able to find that soon on our website, and the address is here on the slide. You will also have that on the slides as you download them. So I know a few questions were answered through a typed format while we were talking. I'm going to go back to a few of those. I'm going to take a look at the ones that are being entered now, and we'll just go back and forth between our presenters as many of these questions that are coming in are specific to Daphne or Melissa. So let's see. So Daphne, the first question I have is for you. If you can talk a little bit more about how you cultivate volunteers so they feel like a volunteer for Respite for All versus the host facility, whether it's a church or another location.
Right. I thought that was a great question. We really like to build a great relationship with that host church. We don't want the church to just say, hey, you've got free space. We want them to see us as a ministry and an outreach of their church. But we also do a lot of training in how that host church can be a community asset and how we want to invite different partners, the Jewish, the Baptist, the Episcopalians, whoever it might be. We've also got nursing students from the local universities, like some of you guys. We view it as a partnership and not an either or, if that makes sense. So we really coach our programs how to partner together with that host church.
Great, thank you so much. Melissa, here's a question for you about training students. Can you tell us a little bit about the most effective way you have found to train students? Have you used virtual and in-person formats, and is one better than another?
Yes, I think with COVID, people have really embraced the virtual format, and that goes the same for our students. And so I will say that our students, they are incredibly busy. Oftentimes, I can't get a hold of them until after 5. And so, yes, the online format really has served us well. It's the best way we can kind of schedule something for folks. That being said, our North Carolina Central students, they are in kind of an accelerated program, and so their classes are Thursday nights and Saturday during the day. And so Monday through Friday, they are in person in our agency with us. So with those trainings, we have been able to do those in person.
Great, thank you so much. Okay, Daphne, can you talk a little bit about how you're able to operate without licensure as an adult day program, so everyone can understand a little bit of state-by-state differences?
Yes, that's great. So in the state of Alabama, we do not have adult day regulations under the health department. So we have 14 across the state of Alabama, but we worked closely with Florida, who you know is probably heavily regulated. We have 3 programs there. Because we don't give medicine, because our participants are early to moderate stages, that I'm glad somebody asked this question, they have to be able to handle their own restroom needs. They've got to be able to be in a group setting and feed themselves, because we give no medical care. And, you know, roughly we would go with the state guideline. I know in Georgia, for congregational care respite, it's 22 participants. In Tennessee, it's 16. So we go by state what those state regs are. But because we give no medical care, there's a 4-hour volunteer training, and they are background checked. We were able to operate under the faith-based community.
Great, thank you so much. So, Melissa, a few questions have come in about how you initially identified and connect with university collaborators and found the right people to talk to get buy-in and then eventually start recruiting your volunteers.
Yes, I mean, I will say that especially in regards to the Duke Hand students, they came and found us. These were really a motivated group of undergraduate students who really wanted to meaningfully volunteer in a way that satisfies them. They didn't want to necessarily do the scut work and the data entry, but they really wanted that face-to-face interaction, and so they came to us. In terms of developing the partnerships, Durham, it feels like a really small community, and so by participating in like Partnership for Healthy Durham and Partnership for Seniors, I mean, these groups really kind of come together and we are able to find each other. And so I think it's the reputation too of the Durham Center for Senior Life is just being a really welcoming and opening environment for students that has, allowed these administrators to come to us.
Great, thank you so much. Daphne, can you talk a little bit about the best ways to train the older adult volunteers? What are the methods that have worked best, and have you had any experience, success or challenges finding volunteers in rural areas? So first part of the question is, what's the best way to train older adult volunteers?
Well, our program goes from 10 o'clock to 2 o'clock. And I like to have our volunteer trainings scheduled 3 weeks in advance from 10 o'clock to 2 o'clock. We provide a lunch. But what I have found that people latch on to, we've got a 15-minute Teepa Snow brain changes video that she's given us to use. It's free on her website. We use Karen Stobie's TED Talk on going with the flow. She uses improv acting as a method of training for dementia. We use a lot of role play. We don't have a lot of written material. It's several of these videos, Montessori communication things. We like the in-person video training in the summertime when we have our college students or high school. One thing I'd like to add, our families, when they have grandchildren to come and visit, we invite those children to come and be at Respite with us so they can be with their person in a group, because it's so hard to be with somebody one-on-one with dementia. So we have a big family atmosphere. But for our college students, we have found that our Teepa Snow and our Karen Stubby, our training videos are good for them to watch on their own time. But really for the older adults, it's in person. They are looking for purpose, and they really enjoy the training and learning.
Great. And then the other question was, how have you been successful or had challenges finding volunteers in rural areas, if you've experienced that to date?
Well, I'm gonna tell you about a small program that we have in Demopolis, Alabama. It's probably in the middle of 15 cow pastures. It is just out in the country. But at the First Methodist Church there, there's like the town center. Through our concept of making this a community asset where one church doesn't own it, they want to invite everybody to be part of it. Word of mouth gets out, volunteers from all different churches, walks of life. They don't have to be a member of the church. They just want to be able to help Alzheimer's families. This place started with 5 participants, and now they've got 15. But when I talked to the director after like 6 months, they had been in operation 4 or 5 years ago. She said, we have 28 coming. And I said, what do you mean? And she said, I just can't get anybody to go home. And I really think that in those small towns, when you've got something happening, when you're on to something, people are drawn to that energy. And there again, it goes back to our mindset of everybody's got something to offer. So that director is really trained on how to train the volunteer to look for those opportunities. The volunteer is not just a babysitting service. That volunteer works, and they know how to create that space for people to matter. So I think that really helps. And so we've got success in small towns and large cities.
Great. Thank you so much. Melissa, can you talk a little bit about what you've heard when students are recruiting other students? Do you give them materials to do that? Is it just word of mouth about their experience? Any incentives provided? Can you talk a little bit about how that all works?
Sure. So I do think a lot of it is word of mouth. Again, the DuCan students, they meet monthly, and so I always make myself available to, get in front of the students and kind of give them an update on the volunteer opportunities that we have to kind of gauge their response. In terms of, the placement of the Master's in Social Work students, we did create kind of a job description, so that was kind of disseminated amongst the program, so they kind of, for those that were interested in social work experience with older adults, they could review our job description and get in touch with us that way.
Great, thank you. So this question has come up a few times, and Melissa, it's for you again, and Daphne, if this applies to you, please feel free to jump in. What do you do in the summer when your volunteers may not be in your area and they go elsewhere?
Sure. So I will say that we have been really fortunate. A lot of, especially a lot of the Duke students, like for example, we had one of our students graduate in May, and we had a big send-off, and we said, thank you so much, good luck with everything. And then a week later, he reached out, and he's like, great news, I got into this amazing graduate program in the UK, but it doesn't start until October. And he said, can I volunteer? He was one of our weekend respite volunteers, and he was like, can I volunteer Monday through Friday, 8 to 5 in the adult day health? And I said, absolutely. So, and then another example is, one of our interns came back early. She says, I'm back in town. This is, as of July 15th. And she's like, when can I get started again volunteering? So yes, I think with the dementia care management program, I do think our dementia care managers do miss them during the summer. And so we make it a point, especially with that program, to not make the success of that program dependent on the students. They are just an added asset to the program, but not dependent on it.
Great, thank you. That helps explain it a lot. Daphne, a question came in about your mention of Montessori principles. Can you describe how those Montessori principles are translated into your training?
Yes, I was trying to answer that typing, so I'm glad you asked. I have worked with Dr. Kemp several times, and we're working on a partnership as well. But we really try to implement those 12 steps of taking our time. Our activities always have purpose some way. They look kind of silly if we're playing ball games or this, that, and the other, but how are we finding purpose in those small moments in between? The speed of how our friends perceive our language and our communication skills. We roughly cover about 30 to 45 minutes introducing those Montessori principles into our volunteer training. And it's just worked very well for us.
Great, thank you so much. Melissa, a question came in to ask about, and this may differ based on the different universities, is participation considered just general volunteer experience for some of the students? Is it clinical experience? I know some of them are there for their Master's in Social Work practicum, so that's a different kind of experience. How many different kinds of student volunteers and kind of requirements are they checking off when they come to?
Yeah, sure. So the DuCan students are strictly volunteer. They are just interested in kind of getting that volunteer experience. I'm sure it also helps kind of bolster their resumes, but they just really come to us for volunteering. In terms of the service learning class, there is a required, I think they have to do, 20 total hours within that class of service learning. And then, of course, with the Master's in Social Work students, that is a practicum, and so they are required to do, 336 hours per semester, so that is also a requirement. So, yes.
Great, thank you so much. Okay, so most of the questions that remain are items that we've talked a little bit about already. I do want to offer an opportunity for both of you, Melissa and Daphne, to offer any final remarks before we close out for the day.
I'll start, and Melissa, you can close, I guess. I just want to share with you guys that we received a $50,000 grant from a foundation in California to help sponsor a video series for training, because they recognized that we were able to replicate what did we need. And I explained, not everybody can get to Montgomery, Alabama, but I wanted a whole vision team, a whole leadership team to see the modules of, number one, what are we looking for in a volunteer director? Number two, how do we partner with a community church, with the business, the logistics of how we do our program with local churches? And three, a big part of this is marketing and sustainability for our programs. And then we get into volunteer recruitment and volunteer training in the last segments. And in that video training, we also offer a PowerPoint for local directors to use in their volunteer training. We wanted to resource local programs that I knew wouldn't have time to invent a program. So we want to give you every resource we have: budgets, books, marketing, brochures, everything we have is yours. And we just didn't want people to have to reinvent the wheel. We wanted to get these up and going and have people hit the ground running. So you can look at our website, respiteforall.org, and email me at djohnston, Johnston. I'm sure it's on this website, but djohnston@fumcmontgomery.org. That's FUMC Montgomery. And I can send you our training link that's got all the videos on it.
Great. Thank you so much. And I just went to your slide, your contact slide real quick, Daphne, while you were talking. And Melissa, any final remarks you'd like to make?
Yeah, I think Daphne obviously touched on this point throughout her entire presentation, but I think just the relationships that you form with the students, with your volunteers, with college administrators, it's just so very important. I think at DCSL, we really pride ourselves in listening to the students and hearing kind of what experience they want, and then really crafting something that benefits not only us, but also the students themselves. And I think that's why we continue to have the students come back and bring their friends. So yeah, I think just at the end of the day, it's just being really good stewards of that relationship. Thank you.
Great, thank you so much. Well, thank you everyone for joining us today at the National Alzheimer's and Dementia Resource Center webinar series. You can join us again on September 12th for our webinar, Building Partnerships to Scale Effective Dementia Care Supports. This will be information provided by Indiana University and Indiana's Area Agencies on Aging. And for now, I will turn the floor back over to Julia for her final remarks.
Yes, thank you so much, everyone, for joining us today. Thank you to NADRC and ACL for your support of this series. Again, we just want to remind everybody that if you would like to claim CEUs for today's webinar, you will be receiving a follow-up email by the end of the business day today that will contain a link to the CE application. You will also have the ability to download the slides from that email. You have 60 days to claim CEs for today's webinar, but please note that it may take 30 days for us to process and issue your CE application. Thank you all so much, and we hope you will join us again soon. Thank you so much. Bye-bye.